Hello, everybody. My name is Jade or Jonathan Patton, and I wanted to talk about some exercises that bedridden patients or immobile patients can do. Let me turn that down just a bit. And patients that they can do that would help them with their mobility. And not the purpose of some immobility is for the person to get better. There are other cases that involve hospice where the cause of the immobility will never be solved. But if there is chances for recovery, there are a few exercises that you can use. One is the palm stretch. Okay, so let me describe this to you. You're going to take the client or the patient who's bedridden, will take their hand and try to stretch their palm as much as they possibly can till they can feel the stretch in the roots of their fingers. Okay, then they're going to take their thumb and touch each finger. You want to get fancy? But that is what they're going to do. And you can do that a couple times a day, and that will help with mobility and cognitive thinking and associate and help build those nerve pathways that are so important that sometimes our body can forget as we're immobile. The next is the arm lift. Now, the arm lift is basically very simple, easy explanation. It's basically in the title, arm lift. Okay, so the client or the patient is going to lift their arms. I don't know if you're old enough to remember sure or unsure. No, but the client and the patient is going to, or the patient will raise their arms above their head. Now, for as long as they can. Now, if the client or the patient is not able to do so, what you can also do is have them do a 90-degree elbow uh, lift, which involves them lying their this part of their arm onto the bed and then trying to lift, but keeping that straight and parallel to the ground, and for as long as they possibly can. Next, you're going to go to wrist rotations, okay? And wrist rotations, again, another simple explanation. Have your patient or client hold out the wrist and just bend to the left, to the right, left, right, left, right. And they can do that a couple times a day. Now, there's another important exercise I want to talk about, and it's called ankle plantar flexion and dorsiflexion. Now, plantar means pointing down, dorsal means pointing up. So when I do plantar flexion, I'm going to point my feet down. Now, you can have the patient, if they're laying in their bed, to straighten out their legs, and these are my pretend feet. And so they would push their feet down, right, as much as they could for maybe 10 seconds, then lift it up and release. And do that about 3 to 5 times, as much as they possibly can, because remember, our purpose is to get immobile. I don't know if you know this, but doctors are now saying rest, just rest, period, is not a good idea. Relative rest is a good idea. So we want to get them up and moving as much as we can, get that immune system, that lymph drainage going, and get that immune system kicking in. Another exercise that I'm sorry, addition to that exercise is if you have a caregiver or someone in the hospital who are, as you, the holistic healthcare practitioner, are assessing your client while you're doing the plantar flexion and dorsiflexion, you can add resistance, and that will have the patient pushing against the resistance that you do, and that'll be really good because that will help them build up those calf muscles and those ankle muscles, which will help them become mobile. Last but not least, we're going to talk about the leg lift. Now, the leg lift is as simple as it can be. You're going to want to lift your leg all the way up. Try to lift it as much as you can without causing pain. Not that high, obviously, we're not all yoga teachers, but you want to lift your leg up, hold it for as long as you can, let it go. And you want to do that 2 or 3 times. You want to recommend that 2 or 3 times to your client. So there's also another one I want to talk about really quickly. I know my time is almost up, but this is called a single leg hip lift. Now, single leg hip lift. So what they're going to do is they're going to put, as they're laying in the bed, they're going to put a left foot down, and they're going to raise their left foot down for a bent leg and straighten the other leg out. Then they're going to lift their hip as much as they can with that bent leg, and then they're going to release. And they're going to switch sides. These exercises are designed specifically, and they come from a multitude of sources. Even just a quick cursory glance at the internet will give you any kind of information on how to help your bedridden or immobile patient. I hope this helps, and have a wonderful day. Love from Spain. See you guys later.